Hi, my name's Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. Here with someone from my home state of Illinois, Phillip. The computer system went down, then I heard you talking. I heard you talking to one of the other patients in the waiting room that you had like horrible yawning for like 15 years. Then I went there and I asked you, how's that doing after the prolo? And you said, no, way better. People don't realize that chronic yawning or excessive yawning, it's a sign of intracranial hypertension. So I thought it'd be good for us to just do a short video on that. So can you explain like when the whole yawning thing started?
Absolutely, yeah. So I was in a motor vehicle accident in October of 2007. I was hit from behind, heard a strange noise and went to look behind us, and that's when we got hit. So it kind of sheared my neck that way. But anyways, I had no pain, it just, my neck felt funny. So I went home, I went to sleep, I woke up the next day and sat up in bed, and that's when things started going crazy. I couldn't feel the right side of my face, my hand was feeling funny, and my throat was starting to spasm and do weird things. But honestly, the thing that I noticed right away was my yawns. I sat up in bed that morning, and my yawns were different now. They were in slow motion, so they took 2 to 3 times longer. You know, like the yawn was longer, and my throat would spasm as I would yawn. It would constrict as hard as it could till the muscles were tearing apart. And most notably, I could not stop yawning. I would yawn 300 to 500 times in a row, sometimes for 3 hours or more. I could do jumping jacks, slap myself in the face. It wouldn't stop. Every time I would yawn, every single time I would yawn, 2 or 3 tears would pour out of my right eye, just my right eye. And I mean, obviously, this was all very unusual to me. And I sought help for 15 years. I saw a different PhD every month for 15 years. I'm not kidding. I had seen 30 or 40 chiropractors. Absolutely nobody could give me any answers. Nobody even really addressed my problems. And they definitely had no idea what was causing it. Like, nobody.
Then you came here.
So, well, first I found an upper cervical chiropractor who actually knew that my C1 and C2 was the problem. Mm-hmm. And the first adjustment, all he does is take 2 fingers behind your right ear and push with about 18 pounds of force. And I sat up, and my face went back to normal. My hand went back to normal. And my yawns went back to normal. The first thing that happened, he hit my neck, and I sit back in a chair to rest, and immediately tears start pouring out of my right eye.
Wow.
Just constantly. Like heavy, like a faucet that's been turned all the way on. It was just pouring.
Yeah.
And it would not stop. And this was the first time anyone had ever done anything to affect any of my pain or my yawns or any of my strange neurological symptoms. So I was really excited. I was like, I finally found somebody who knew what's wrong with me, and he poked the bear, you know? But then I'm sitting there for 300 seconds, and the water is still pouring. I counted out 300 seconds, and it was still pouring. And I was like, oh my gosh, this guy might have just broke my neck, and this is permanent or something, you know what I mean? So I twist my head left, I twist my head right, and I get a crazy snap and a pop and a weird nerve pang. And when I go back to center, I had the first normal yawn I had in 15 years.
Good, wow.
No tears with it. The yawn was a normal length. It was nice and short and sweet, just like it was for the first 20 years of my life. You know, I recognized it. I recognized it as a normal yawn. And ever since then, it's been incredible.
Good.
With the chiropractor keeping things in alignment, and then me coming in to get prolotherapy so we tighten up around that good alignment, the results have just been incredible. I'm barely yawning
What other
anymore.
things? Well, let me ask you this. What made you decide to get prolotherapy?
Because I knew that I was dying, because I could feel my brain. I couldn't even think sometimes. Like I couldn't even. I couldn't even like plan things out.
You're saying even though the adjustment helped with the yawning,
some of
the things didn't quite get all the way better.
So, well, the problem was I was so unstable that even if I had a chiropractor put me in alignment, 3 days later I'm out of it.
Oh.
And the
Did
thing
the yawning then come back? The
Oh,
excessive
absolutely. Oh, no, it would happen instantly. So the thing is, I can feel my C1 move out of place. I can even hear it. It makes a funny noise.
Okay. So
I'm
it
serious.
wouldn't stay in place. And then
Oh,
you
no,
get
absolutely
the symptoms
not.
back.
The most I could keep my position without prolotherapy was about a week and a half.
Okay.
And that's the most, and that's with me not working, staying in bed, not even doing laundry or grocery shopping.
Explain all your symptoms.
I can't because we don't have long enough in the day. I'm serious now. I mean,
Well,
I'm
give us
serious.
your top
It would
10.
take us an hour. The biggest things were, like I said, once I woke up that morning in 2007, the right side of my face is very numb and tingly, and it would burn
Yeah.
and be painful. It was affecting my jaw. I couldn't. Sometimes my S's would start to because my jaw wasn't working. And then I couldn't feel my hand anymore. I had incredible stabbing pain right here in my hand. And then these 2 fingers weren't working good. I had no grip strength. I couldn't open a bottle of Gatorade for 3 years. I couldn't work for the last 2.5 years, not even doing menial jobs, you know. And then I would fall over sometimes. I would get dizzy and fall over for no reason, and it would happen in an instant and go away an instant later. I would just kind of come to on the ground. I had no idea how I got there. Drop attacks, you know. The brain fog was the worst. I mean, I used to be able to read 350 pages a day easy, like just because I was bored. And I couldn't finish a Dr. Seuss book, you know? It was just...
That's a good way to put it.
No, and
I bet other
it's so
patients say
hard
that.
to explain
Yeah,
when
right.
when
I couldn't even
your
read it.
brain doesn't work the way that it used to, you know?
Yeah.
But I mean, just an incredible pain in this one spot in my back where the muscle spasms were so bad. And so the only way to sleep was to sleep on a baseball. I slept on a baseball for 10 years with the full weight on the baseball. That was the only way where I could breathe. If I hit the spot right up against my spine and I dug it in really deep, or a lacrosse ball, those work really good.
Yeah.
I highly recommend those. But that was the only way for me to sleep. That was the only way for me to get some relief from the muscle spasms in my neck and my shoulder. It was just so bad.
You had said to me that you felt there were some dramatic improvements after the second visit.
Oh no, it was incredible. So the first prolotherapy visit was really rough for me. It was just physically a little more rough. I thought it was getting better, but I wasn't sure. You know what I mean? Mm-hmm. And after the second visit, it was an incredible difference. I could tell that everything was tighter. I could tell everything was more stable. My chiropractor told me I was more. He could feel it and tell. He could just be like, "You're getting better." Awesome. I was holding position better right away. And I've only seen the chiropractor a couple of times since my second injection, and most of the time when I go, I'm fine. He can't adjust me because I'm in a good spot, or a good enough spot.
Some of your symptoms start to decrease some?
Not some of them, all of them. All of them have decreased. Everything has gotten better. My throat is totally calmed down to the point where muscle is even starting to build back up again, because it would just get destroyed every day. Yeah. Every time I would yawn, all these muscles would rip themselves out of my neck. Okay. And I mean that. I mean, they would be destroyed, and then, oh my gosh, it was just so painful, you know. Everything about it was so painful. But everything is better. My hand is better, mostly because my spine is no longer in that forward-facing S-curve. It's going away. It's just gone now. The other really dramatic thing, so when I woke up in 2007, my head was tilted at about 30 degrees. Okay. And it stayed that way for 15 years. Okay. And it didn't go away until my third prolotherapy treatment. Okay. And my third prolotherapy treatment...
You can hold your head straight.
Oh, yeah. I mean, it's... Like I said, I should...
Like everybody else.
1 year ago, this is how I sat. This is how I would be doing this interview a year ago. Just like this. And now this is me. You know, and it shouldn't... I didn't even think it would be possible. You know.
So... Dizziness is better. The yawning's better.
The dizziness is gone. I haven't had a drop attack or a dizzy spell since my first prolotherapy appointment. Good. My face is totally normal again. It comes and goes. If I lay on my left side, so I haven't been able to lay on my left side for 15 years. Okay. When I do that, I feel a pinching in my neck, and my face goes numb, and my throat starts to spasm, and I get a strange headache. Okay. So I have to stay on my right side. But I mean, already I can tell the difference. Just like I can even take laying on my left side for a little bit. I still try to avoid it because I know it's throwing me out of whack. But I mean, I can just tell that everything's holding together, and it's better. All my symptoms are better. Everything is better. My stomach is getting better. My heartburn is going away. I mean, the first time that I got my neck pop, my blood pressure my blood pressure was at 140 over whatever. For 15 years. I got my neck pop, it was 125 over whatever, and it hasn't gone higher since then.
That's good, wow.
Except every now and then when I come in here, I'm a little stressed, so it's a little high, but I don't like needles, what can you know. but I still
The
look
heart,
forward.
the tachycardia.
So
that
I was
down.
having, my heart would race sometimes,
Right.
and I mean it would jump up to 200 beats per minute. I
Yes,
know I could
yes,
count
sir.
it. Out of nowhere, I'd be sitting on the couch and out of slam up, just like it was like spinning the wheel on the Wheel of Fortune, where I was totally fine, and then it's like, and it would slow down over the course of about 3 minutes. You know what I mean? And
Yeah,
and when I
those-
lay on my left side, I can feel it. My heart starts to hammer, and the rate goes up dramatically. You know, but all that's gone now. I haven't felt my heart race since the second.
What about your
prolotherapy
vision?
treatment. So the vision's been great. I would only notice it so like during physical activity, my vision would go dark, and I did not know why. I would also like start to feel confused. I would feel like I couldn't think. I don't know. I would just kind of lose track of time or what I was doing, and I'd have to lay down and rest and catch my breath. But
How's that doing?
oh,
That symptom?
it's so much better. You know what I mean? And I still can't do too much just because it'll throw me out of alignment. So I'm taking
That's
it
fair.
easy during this prolotherapy process.
brain fog and the. What about your ability to read? Like,
Oh no! All
It's
that's
getting better.
the main thing that I noticed right away is just my energy level. I mean, I haven't been able to talk this fast or move like this or feel like this for years and years and years. But the brain fog is so much better. I'm reading faster. I'm thinking quicker. I can remember things better.
great.
My short-term memory was awful for years, and I couldn't understand why. I mean, I was always one of the smartest people, you know, around, and I was struggling for years,
Yes, sir.
just with the basic things, just thinking and reading and stuff. But no, everything has gotten better. All of my symptoms.
Fantastic. Yeah. No, we just appreciate you, sharing. your
No,
story.
no, because people need to know. And I mean, I really did try every day, every month for 15 years. I tried to get help, and absolutely nobody could help me except for here at Caring. You guys
appreciate that.
y'all are the only ones that really know and understand what people like us are going through, and y'all are the only ones that are offering results like this for sure.
Thank you so much.
No, thank
you,
you.
Phillip.
No,
Appreciate it.
no,
Thanks for
seriously.
sharing.
Absolutely.